Hi, my name is John Gibbons, and today I'm going to look at manipulation of the thoracic spine, and in particular to the rib cage. I'll show a variation of techniques here. So for instance, if his spinous process was sitting and you've got T1 down to about T12 here, and then obviously the first rib, second rib and so on comes in, so we're going to look at this area in particular. If we want to manipulate the thoracic spine, there's a butterfly spring technique where we would keep our hands very close to the spine in itself. Let me show you on the skeleton. Excuse me doing this. So I'm just going to rest that down. So if you've got the spinous processes and the TPs, then if you kept your pisiform close, then you could affect the movement of the transverse process. If you took your hands slightly away, across, then you're going to be more towards the angle of the rib. So if you're pushing over here down, then it's going to spring where the rib comes into the transverse process, the costo-transverse junction. If your hand is closer, you might find you affect the position of the transverse process. So the first technique we're going to do is just a gentle spring-in technique. So what we're going to use is the cloth of a t-shirt, or you can use a towel because it grips. You can use it to grip. And then one hand either side, does not matter how you place the hands, whether you go in the right hand leads or the left hand, I tend to vary it. So I'm going to get my patient to take a breath in, please. And then they breathe out. So my hands are wider, this is more ribs. So I'm going to rotate and slowly just start to spring the ribs. This is almost like an assessment into a treatment because it almost like tells you what side you feel is stiff. Take a breath in again. Breathe out. So I'm going to rotate and then spring down through the ribs. If I change my hand position, breathe in again. And then breathe out. I can rotate. And I'm going to spring. The difference between a mobilization and a manipulation is just the speed of execution here. And obviously it's more of a thrusting technique. But I'm very close to thrust on what you've just seen. Let's just do a little thrust technique here. Take a breath. And then breathe out. Breathe out. You lock. And then the thrust would be down. And breathe in again. And then breathe out. So we rotate. We lock. And then the thrust is simply down. And then sometimes you can hear a cavitation. Once more, breathe in. There's a little bit of stiffness on up his top right, and breathe out. And lock, and then the thrust is more down. Good. Now that's one technique for the rib. You can also use his pelvis. Hand onto the ASI. Be careful where we are here. So we're going to slowly pull his body towards me, and then we're going to come onto the lower ribs. And I would normally say to my patient, take a breath in. And as he breathes out, I will pull, I will lock, and I can mobilize here. So I can mobilize the ribs. Take a breath in, breathe out, and I can mobilize. So I can just lock and mobilize here. And sometimes it's probably more comfortable for the patient if you mobilize. Because if you thrust in every time, you can be a bit irritated. Take a breath in again, and breathe out. If you wanted to thrust, you can lock, and the thrust is simply towards the opposite shoulder. Okay, so you're going to go towards the axilla on the opposite side. Breathe in again. And as you breathe out, you lock, tension, thrust. And then that would be an alternative way of trying to cavitate the joints. And one more, which I particularly like, is almost using the two hands in a similar sort of fashion. And then let's say, for instance, we're on T7, so we're going to come to T6. Using the sort of, well, the pisiform area, we almost come in like this, and we can put the fingers together and we can lock. Take a small breath in, please. And as you breathe out, we lock, and the thrust is down towards the couch. Take a breath in again, and breathe out, and lock, and the thrust is towards the couch. And again, you might get a cavitation depending whether the rib needs to be released or not. And then we have HVT or mobilization techniques for the rib cage and also for the thoracic spine. I hope you enjoyed the video. Please subscribe to my channel as you'll get all my new videos. Thank you for watching.